Tonight we have a range of speakers who will be able to explain a little bit more and answer some of your questions that you may have. One of the things that we have decided to do is to remove the chat, ability to chat, so you won't be able to speak. So you'll be able to have the chat function to put your questions into it. We're going to have two polls, one at the beginning, just to test what people are saying, then one at the end, and in between that, we're going to have the speakers come on, and I'll introduce them individually. So if we can raise the first poll, please. So if you could go through and answer this in the way that suits you, we then can end the polling. Right, so the polling will be ended shortly, and I need people to actually start answering the questions or putting a response into the questions. I'm going to give it a couple more minutes. Right, 30 seconds. Okay, we can end the polling. And I'm going to share the results of what people have said. So I am attending this webinar. 40% says because they don't trust the information provided by government. 20% says they don't trust the vaccines generally. And 40% said none of the above. And the second question was, I'm hesitant to take the vaccine because 40% said medical concerns. 60% said none of the above. And finally, if my questions are answered in this webinar, I will take the vaccine, and 60% has said yes. And obviously 40% said maybe, but nobody has said no. So thank you for that. I'm now going to ask our Brent Central MP, Dawn Butler, just to address you and give her views on the matter. Dawn, if you can unmute yourself.
Thank you, Robert, and thank you for organising the meeting today. Thank you, everybody, for joining. As you would have seen in the news today, the vaccines have been working, and that's why we have now seen such a fall in not only hospital admissions, but those people who have died from or with COVID. In Brent, in the last 7 days, we've had sadly 9 deaths, and we have 2 people admitted to hospital on average every day. So it is still quite substantial in Brent, so we still have a way to go. I'm hoping that there has been obviously in the news and in the papers, some worry around AstraZeneca, even though it is still very rare in regards to the blood clots that occur. It is very rare. I'm not sure if that's having a direct effect actually on those people who are hesitant in taking the vaccines. I think the people who are hesitant in taking the vaccines, it's made them more hesitant. But on average, I think that people have been taking the vaccination. I myself has had the first AstraZeneca vaccine, and I'll be getting my second dose on Saturday. As I've always said, it is an individual choice. I do understand the concerns, but more my main area of concern and what I want to ensure is that my people in Brent survive. I want to make sure that I don't lose anybody else in Brent. I want to make sure that, you know, we live to see another day, and I also want to ensure that we look after the elderly in our community as well. So it's important that we have these conversations. It's important that we answer questions. I thank everybody for joining. I will be on here for a while, I think until 5:30, until I've got another meeting. And I'm happy to answer any questions that I can. So thank you, Robert. And stay safe, everyone. And even though, and I'm sure the doctors, everyone will be coming to this, even though lockdown is easing, we still have to be careful and take our own personal responsibility. You know, just because the government says you can go hug somebody, it doesn't mean that, you know, literally you can. We still have to be very careful. We are very hygienic anyway, but, you know, we just have to continue with all those safety measures to ensure that we keep ourselves safe and others around us safe. So thank you very much, Robert, for having the meeting, and it's a pleasure to join you all today.
Dawn, it's a pleasure to have you, and you are no stranger to New Testament Church of God.
No, my church.
Yes, that's right. We are, just to let you know that you can start putting your questions that you want answered into the chat now, and continue to do so even while the presentations are being made. We will be introducing the panelists, and the next person coming on is Dr. John Licorice, which is Brent Council's Deputy Director of Public Health. He's going to be talking through the impact of COVID on the Brent community and the levels of the take-up rate. And he will also address some common reasons for people not wanting to take the vaccine. So over to you, John. John, you're on mute. You're still on mute, sorry. That's it, you're on.
That's it. All right. Thank you, Councillor Johnson, for your kind words. Thank you, as always, Tom Platter, for your wise words on this matter. I'm going to take you through some of the issues that we've had with regard to this vaccine. Apologies for those of you who have heard this all already, but I think it's useful. I think it's useful if I do that. So I'm going to share my screen now. All right, are we seeing a presentation?
Yes.
Good, so I've got a lot of slides here, but I'm going to, I thought I would cover a lot of information, and I won't speak at length of it because my more esteemed colleagues following me, I guess, will speak to most of it. As Donna suggested, coronavirus hasn't gone away, and I know there's a sense of goodwill around. I know the messaging has been that we should everything's dates and lighting it up, but I just really like to remind everyone that we've had 127,000 plus people have died, and that's using the government's definition. The actual number of deaths is a lot more than that, and still we've had nearly 15,000 cases of coronavirus in a week. So coronavirus hasn't gone anywhere. Again, even in Brent, in the last 7 days, we still have 84 cases of coronavirus, and unfortunately, we've lost over 850 people from coronavirus in Brent. And again, it still continues. We still have people in our acute hospitals very ill, very unwell. So I just want people to realize that, remembering that the days are getting longer. We're getting vaccinated. Everyone's feeling very good, but I just want people to be very aware and echo the wise words that came from Dawn earlier. Just a bit about the vaccines. Again, lots of queries people ask me about how vaccines are prepared, and I want to make a couple points. Vaccines, the preparation for vaccines is more rigorous than any of the common medications that your doctor will prescribe to you. And most people are very happy to take their medications before asking where they come from, whether they've been tested. Because vaccines are given to people who are otherwise healthy, they're tested more than your other medications that you would take, whether it be antibiotics or other drugs. And the reason we do that is because vaccines are given to quite healthy people. So we get lots of questions about testing, but just bear that in mind. Your vaccines are tested more than any of the common medications that you commonly take. So why were they produced quickly? Well, there was a lot of will to produce vaccines. There's not much money making vaccines, so normally they're very difficult to make, but there was a lot of will around everywhere. There was lots of funding from governments because they wanted to get them done in a hurry. And we had a situation where literally in the pandemic, there's a race between humans and the virus. And I think that focused minds, allowed universities, pharmaceutical bodies, national public health bodies, the World Health Organizations to all work together. And your drug companies who make vaccines, instead of working against one another, they work together and instead of competing. Point to note about this coronavirus. This is not the first type of coronavirus we've had. There's some forms of coronavirus which commonly present in form of common cold, and we've had two more serious forms of coronavirus, one called SARS and MERS, and those of you who follow things would have known that. So we've been looking at that, and we're looking to try to prepare vaccines for that. So we didn't start from zero, because in terms of preparing these vaccines. And normally we go through a series of trials and studies, and Tom will speak to that a bit later. But all those were put together and worked together in a format so that instead of taking a long time to do something, we can do something very quickly. And we were able to look what the genome sequence, which is actually structured the virus, was publicly available very early in 2000. So I prefer to think of the fact that when people say, why was they produced so quickly? I think it's a success actually of science that we were able to produce this vaccine so quickly. And I think it's something really good and something which we are looking to replicate. A bit about the AstraZeneca vaccines produced a lot of debate about it, but it was tested in lots of people in lots of populations. It was found to be to work quite well in older and younger people. If you look at the data, it would suggest, well, it was used more in white populations and black populations, but it's something we have to consider as people. We tend not to want to volunteer to do trials, and the only way you're going to find out how things work is actually to volunteer for trials. And I would say, just as I'm in good company, just as Don has done, I've had the AstraZeneca vaccine. I've had 2 doses for it. My mother has had 2 doses for it, and all of my family have had AstraZeneca actually. So I can personally say to you, I think it's quite good, and touch wood, it seems to be working quite well, and I've had no problems with it. So the first point, sorry, it's a busy slide, but I'll just summarize it. And this is data coming from the regulators, independent regulator. People issue with the government, and I also like to tell people, vaccines they're independent regulators that develop vaccines. The Medicines Health Regulatory Agency. There's also the European regulatory agency, and they're responsible for vaccines. And they're independent of government. I know because I've worked with them when I used to work with central government, and the recommendations they make are not political and are not influenced by politicians. So we know it's safe. We know it's worked to be given to millions of people. We know it has some side effects: pain, tenderness in arms, feeling tired, and headaches and aches. So everyone's going to tell me, what about the blood clots? Well, first thing to tell you about blood clots is that coronavirus itself, the disease, makes you, depending on what study you look at, up to 100 times more likely to get blood clots. And that's because of, in one of the advanced stages of the disease, it tend to get a clotting phenomenon. So you start from a point of view of a disease that makes you far more likely to get clots. The chance of you getting clots is extremely rare. It's so rare that it's a level of risk of almost of you dying in a car crash or something like that. It's something that, yes, it's possible, but when you balance that with the risk of the vaccine, of the disease, which is 100 times more likely to get clots, I think you have to put this in context and say that it's really, the risk is not something that I would concern myself with. It is there, but the risk related to the risk being pregnant is there's a higher risk of getting blood clots and also of taking a contraceptive pill. So I'm just putting it in a context of saying that, yes, there's a likelihood, but I think we have to look at this disease, which, as I showed in the early slide, has killed nearly 900 people in Brent. The Pfizer vaccine, again, that's been tested in people right around the world. It's been quite safe. It's been given to children in age 12, and that's been rolled out in some places, and I suspect that will be coming to us at some point in time. The Moderna vaccine, which is available, there's not much of it around, but it is available, and may sometime in the future, it may become something a bit quicker. As I mentioned earlier, we've got lots of doses of vaccines. We've given 35 plus million vaccines, so this is why we know that the vaccines are pretty safe. The side effects are pretty minimal, and we've managed to give lots of people second doses. So one of the things I mentioned, people, well, I don't want to be a guinea pig. Well, it's almost like a train that's running away now. So I think people need to stop thinking about it as a guinea pig, in the sense of we need to get on this train, because there's lots and lots of people have had this vaccine, and this is just in the UK itself. In Brent, we've given over 100,000 doses of vaccine, and this is really good. The unfortunate thing, however, is that if you're looking at this slide here, shows people who are not wanting the vaccine, people who are declining it, and unfortunately, we see that among Blacks, we have a higher level of people declining the vaccine. It's not just in Britain, North West London. And it's for all the reasons that I'm well aware of, the issues that we don't trust, as Councillor Johnson's mentioned, we don't trust the government, we don't trust the information. But all I can ask everyone is if you can try and trust the science, because this is really about science. At the end of the day, everyone has to make their own decision, has to make their own choice. But I think we all have to make decisions which will help to protect not only ourselves, but our elders and our older people who are at risk. And I think we all have a duty to, whatever decision we make, we need to arm ourselves with the information we have, get good sources of information, and not necessarily rely on something that will end up from from social media that we may not know the cause of it. This is just a slide which is looking at where communities live, and what this slide essentially shows is that the better off you are, the more likely you are to have the vaccine. Whereas the worse off you are, the less likely you are to have the vaccine. And that reflects itself with where we tend to live in Brent. So I think the onus is really to try to protect us, because at the end of the day, we were the community who was suffered most from coronavirus. We ended up disproportionately dying from coronavirus, I think, and unfortunately, we are less likely to take the vaccine. So I think we really need to, among ourselves, consider the information and consider our decisions and decide what we are going to do. I've discussed the side effects briefly. They're all very mild. They last less than a week, and some people have no side effects whatsoever. The slide is a bit out of date, but essentially the independent regulator looks at all of the reactions, and some of these are not necessarily triggered, but a lot of these reactions are what we would expect from a vaccine. Just a bit about the new strains of the virus. There's a lot mentioned about variants. To my mind, there's a bit too much discussion about variants, really. The predominant variant around the world is the UK variant. That's the one that seems to spread faster than most other variants. And as it stands, although we have some other cases of other South African, Brazilian, Indian, other variants, the UK variant is still the predominant one here, and it still seems to spread better than all the others. And the vaccines will protect against that. And at some point in time, they may have to change the vaccines. This happens, do it with flu, but it's not a reason not to take your vaccine. So if you get offered a vaccine, get your information, make your decision, and as I would often suggest, take the first vaccine that's offered to you, unless you are someone of a younger age where they may offer a particular choice, and that's related to the fact that in people very young, the disease doesn't tend to cause much ill health. The risk, of course, is that you're catching it to someone, so that's where you might want to consider one of the other vaccines. It doesn't contain any animal products. When you get the vaccine, you can't assume everything is happy. You need to wait 12 to 14 days after the first dose to get some protection, and you do get protection after the first dose. But we need a second dose for long-lasting protection. If you've already had COVID, do you need to have the vaccine? The answer is yes, because although you will get something called antibodies, which will protect you, they're often short-lasting. If you've had the vaccine, this will be long-lasting and it will be a bit better. So yes, you do need to get the vaccine. And can you contract COVID? Yes, you can. The vaccines take 10 to 14 days. So many people who have contractors said, I've had the vaccine, I got COVID, actually were infected at the time with COVID or in the first days thereafter. And it's important that you take the first dose and the second dose to be fully protected. And we do know that there are some people who vaccines, like any other medicines, may not actually work. We've been aware that many people are very keen on having vitamin D. We should encourage people to take vitamin D, but just bear in mind that vitamin D alone is not going to protect you from having COVID. I just wanted to end this slide to put everything in context, and those of us aware, this is what's happening in St. Vincent. This is the volcano, and it's some pretty dire consequences in what's done to the north part of St. Vincent. It's been quite devastating. It's dropped a lot of ash, not only in St. Vincent, destroyed people's homes and people's livelihoods. And I wanted to do this here to talk a bit about risk. This is a gentleman who went up on the volcano when it was erupting to go and collect some, to take some pictures. So I just put this to look at a sense of when we need to consider risk when we're doing things and put things in context. Thank you very much for listening.
Thank you, Dr. Licorice. We've had a question in the chat to say, will a vaccine be given every year like the flu vaccine?
As it stands, that decision isn't made yet. The decisions are made by the independent, the Joint Committee for Vaccines and Immunizations, where a set of independent body, which is again is independent of government, makes the recommendations. My suspicion is, and they are preparing for another booster this autumn. This is most likely, and again, I don't have, they haven't published anything yet, but this is most likely going to be people at most at risk from having coronavirus. But yes, because the virus changes slightly, yes, there will come a point in time when we will have to tinker with the vaccine. Whether that's every year is open to debate. My suspicion, it may well be the case, but at this time we'll have to monitor the behavior of the virus. Again, this is a very new virus. We know few viruses because we've been monitoring them for many years, so we understand how they behave, but it's quite likely that we may have to. But it may not be everyone. It may be similar to the flu. They may decide that it's only people at most risk of dying who have to take it, but it's a bit too early for that.
Okay, thank you, John, and thank you very much for your presentation. I'm now going to move on to Pastor Alton Bell, who is a senior pastor at Wembley Family Church. Pastor Bell will be providing context about the concerns in the community about taking the vaccine, provide reasons behind the concern, and give some biblical context on the matters of health. So, Pastor Bell, could you take the screen?
Thank you very much. Thank you very much, Robert, and thank you so much, Wills and New Testament, for hosting this seminar or webinar, and thanks for everyone who's joined it. Let me just set a bit of context. Yes, I'm a pastor at Wembley Family Church, but my initial career was as a chemist. I studied as a scientist and practiced for over 15 years as a chemist, then went into studying IT before studying theology. So in terms of the vaccine and how it works and science, I do understand and trust the science. And that's what we're trying to mitigate against here. People not understanding the science and then making assumptions from a biblical perspective. Okay, so let me just share my screen and give everyone a bit of context about what I will be talking about. Okay, so the question that I want to answer or ask us really, so we can answer at the end, is what is God's take on me getting vaccinated? Okay, so what is God's take on us as Christians getting vaccinated? So first of all, I'm just going to look at, it's going to be a brief presentation, but let's look at a few historical reasons for vaccine apprehension amongst the Black and brown population. I scrubbed out hesitancy because I don't think we're hesitant to take the vaccine per se. I think we're apprehensive for various reasons, which I will allude to later on. First of all, some of us are aware that there is such thing as medical racism. And this is historic. In 1932, There was the Tuskegee syphilis experiment, where about 600 Black men were experimented on without their knowledge, of whom 140 died. And then in 1992, there was the fenfluramine studies on inner city Black and Hispanic children, where they were given a dietary drug, knowing full well that to see if it would stop them from becoming criminals when they were older. Again, the parents were paid a paltry sum for them to participate in this. In 2014, there was a tetanus scandal in Kenya. So it seems like Black people were targeted, and the Catholic bishops came out against this. And in 2019, there was a polio outbreak in several African countries and Asian countries, Afghanistan and places like that, after they were given an oral polio vaccination. And, you know, Bill Gates and his company was responsible for rolling out or trying to eradicate polio. And finally, we know that Black women are 5 times more likely to die during childbirth compared to white women. In 2020, they said that Black women were 4 times more likely to die in childbirth. The fact is that if you're Black, you're more likely to suffer at the hands of the medics, it would seem. And so the second reason why people are apprehensive, in my opinion, is a misunderstanding of eschatology. Eschatology is the theology of the last things, of the eschaton, things to come. And so people have talked about the vaccine is a type of the mark of the beast, or it has spiritual connotation with the end times, or the vaccines is a means of controlling the individual. So they're looking at Revelation, misinterpreting it, and saying, you know, it's the mark of the beast, which clearly, if you read the scripture, you will see that it has nothing to do with that. And finally, the last reason I would give why people are apprehensive is a lot of our folks are susceptible to half-truths and conspiracy theories and downright malicious lies. For example, you know, people are still putting videos out or WhatsApp messages out that vaccine will alter your DNA. This is just not true. They're saying that vaccine has a nanochip in them. Again, totally false. You know, you give them about 0.5 ml of vaccine, if that, when you actually get the vaccination. And they're saying also that people are dying from taking the vaccine. You know, these are just, and a lot of our people, a lot of us from the Black and brown community actually believe in these scenarios. And so in terms of religion and vaccine, the majority of religions have no prohibitions about vaccine, although they do have considerations about vaccines in general. And also there are particular theological reasons why some groups will not promote that their congregants take the vaccine, or they might have specific objections to the ingredients. One of those is the cell lines that were used in 1970 to develop vaccine. In terms of Christianity, most Christian denominations have no scriptural or canonical objections to the use of vaccines. These include Roman Catholics, Eastern Orthodox, Oriental Orthodox churches, the Amish, Anglican, the Baptist, the Church of Jesus Christ of Latter-day Saints, Congregational, the Episcopalian, the Lutheran, the Methodists, including African Methodist Episcopal, Pentecostals, Presbyterian, and Seventh-day churches. So there are objections, though, by a few churches. The Dutch Reformed Church, for example, some members have declined vaccine on the basis that it interferes with divine providence. However, others accept immunization as a gift from God to be used with gratitude. There are other denominations who, believe in faith healing, and consequently, they're saying we just believe in prayer and fasting. We don't want to take anything to help us. If we're going to die, we're going to die. It is God's will. And these include Faith Tabernacle, Faith Assemblies, End Time Ministries, Church of Christ Scientists, and they believe that the disease can be cured by fervent, focused prayers. And let's look at the ethics. The most morally questionable issue regarding vaccination is using cell lines derived from voluntary aborted fetuses in the 1970s. And recently, in August 2020, the Catholic Archbishop of Sydney, Anthony Fisher, and the Anglican Archbishop Glenn Davis of Australian Greek Orthodox, and the Greek Orthodox leader, Archbishop Macarius, signed a letter to the Australian Prime Minister warning that believers may refuse to take the vaccine because of its links with a baby aborted nearly 40 years ago. In the 1970s, as I said, they did use cell lines, but this vaccine does not contain cell lines from aborted fetus, and it hasn't been reproduced, hasn't been genetically modified. And however, a lot of these churches still say that in the case where there is no alternative to vaccine available, the use of the existing vaccine is morally acceptable in order to avoid risk for children and the whole population. So look at some of the theological reasons now. The Bible does not specifically speak about vaccine. However, there are 3 general guidelines about caring for the sick. The first one, the human body cannot be treated apart from the soul. So even though we're treating the body, we have to treat the soul. And as we can see, a lot of mental health issues are occurring, which we talked about treat of the mind. So you treat the body for the virus, you now got to think about treating the soul or the mind or the mental health of people. The second thing is hospitality is fundamental motive driving clinicians and hospitals. And this is a Christian principle. And finally, medicine is a divine gift. Psalm 147 verse 3 says, he heals the brokenhearted and binds up their wounds. So theologically, God wants us to be well as our soul is well, as it says in 3 John 1-3. So he wants us to be well in body, mind, and spirit. And so for this short presentation, let me just summarize what I've been saying, that Christianity and humanization, within the Christian creation, fall, redemption, and restoration framework, immunization advocacy can form a basis for Christian service to humanity. This is consistent with the theme of brother, sister, keeper from Genesis 4, verses 9. It's also consistent with loving your neighbor as yourself from James chapter 2, verse 8. And finally, we supposed to act kindly to strangers like the Good Samaritan in Luke 10, helping those who are less fortunate than ourselves. And Christians have historically supported humanization. A few denominations have objected on spiritual and ethical grounds. Humanization and vaccines are placed within the tradition of hospitality. And in the Christian tradition, health is never separate from spirituality and hospitality and the care for the whole person. So health is holistic. It cares for the entire being. So if we're looking after our bodies, we need to look after our spirit and our souls, i.e. our mind. And just to say that on the 10th of February, I had my first Pfizer-BioNTech vaccine. And on the 16th of April, I got my second one. So I'm now fully vaccinated. Thank you so much.
Thank you, Pastor Bell. And I note that there's not been any questions directed to Pastor Bell as yet, but you have time to put questions in the chat. And as with Pastor Bell, I had my first dose on the 8th of March, and I had my second dose on Saturday at the Lewinson Centre at our pop-up clinic. And we know the pop-up clinic will be happening for the next 2 weeks over at the Lewinson Centre. So if you're over 40 and have not yet had the vaccination, there's an opportunity for you to book for a vaccination. Right,
Can I just say, Robert, before, I'm going to go in about 5 minutes. So if there are any questions, can you please put them in the chat and I'll try to do my best to answer them. But we do have Donald Palmer here, who's very good at answering all these questions too.
Okay, and I was just about to say that I'm now going to hand over to Dr. Donald Palmer, who's the Associate Professional of Immunology at the Royal Veterinary College, University of London, and is an honorary senior lecturer in immunology in the Imperial College London. He will be talking about what happens to your immune system when it's put under attack by a virus and how the vaccine works to combat it. And he will also address some of the current news issues being raised about the vaccine. So, Dr. Palmer, you have the floor.
Well, first of all, can I say thank you, everyone. Thank you, Councillor Johnson, and to our host, and also to the other speakers, and you all for listening. I'm going to just give a brief presentation so that we can have a debate about questions. And as was mentioned, I just wanted to take a step back. So I'm going to share my slide. So let's, hopefully you can all see this. Let me take you to the beginning. So hopefully you can all see this. And I just briefly just give context. So I've been an immunologist now for over 35 years. In fact, I got my immunology doctorate at Norfolk Park here in Brent. I've been researching in immunology, as I said, for over 35 years. I've written in books, scientific publications, and I've taught, and I still teach immunology at both the undergraduate and postgraduate level. And as Dr. Lisgrove also mentioned about his role in various regulatory bodies, I should also say I was on the Medicines and Healthcare Product Regulatory Agency, bit of a mouthful, isn't it? So MHRA for short. I was on there with the issue of yellow fever a couple of years ago. And I can vouch, as he said, it's completely independent regulatory body. And if you have any questions about that, please do, put them in. So I want to take a step back and remind us all that we are surrounded by germs. We call them microorganisms because they're incredibly small. And these microorganisms cause disease. But it's remarkable the fact that despite them having caused disease, we have a robust protective immune system that can actually provide protection. And this slide here just reminds us how we can become infected. And basically, there are several routes of which microorganisms can enter into the body. It could be the cut of the skin, and then it gets into our blood circulation. It could be the ingestion of contaminated food, like food poisoning. And one of the most common ones is through the air, the aerosol, through our nose and then into our lungs, like flu, like COVID. And so it's really important, therefore, what we have is a functional immune system. And immunity generally means to provide protection. All right. And I'm really into superheroes at the moment. So think of an analogy. Think of your immune system as basically superheroes in your body that go around and destroy germs. And we know these immune systems and what we have in our body is very important. You know, for example, I was reading recently about, you know, sadly, some young children who actually don't have a functional immune system. And if you don't have one, unfortunately, in some of these cases, you don't actually live past your second birthday. So our immune system is really vital. And there's a whole host of these immune system. Our skin is really important. Even the acid in our stomach is important. But what we've been hearing about when we've been particularly talking about with vaccines and with COVID is antibodies. We've heard antibodies all the time, T cells and B cells. So I just want to put that in context, because one of the issues associated with, and I similarly to Pastor Bell, and I really praise his talk, I don't use the term hesitancy. I refer to it as either vaccine confidence or vaccine agency. And part of that is having a more literature understanding of science, and in particular immunology. So I just want to focus on these soluble proteins called antibodies. Think of them as glue, all right? And why is this glue important? So the question really comes back to, why does virus make us sick? So viruses, what they do, they're sort of little creatures, right? They hijack our cells, they get inside our cells, and basically they destroy it. Think of it this way: if someone was burgling a house and completely ransacked it, went over to another house and completely ransacked it. That's what viruses do. They do that to every cell. They go in and they destroy it. That's what really causes problems. They destroy cells. So these antibodies that we make, the glue, what they do is they're like a barrier. They actually will coat the virus and therefore prevent the virus from getting in. The analogy therefore would be, before the burglar could come into the house, you got extra security to prevent that burglar from getting in. So this is what our antibodies do, these soluble proteins, okay? Now, what's remarkable about our immune system is actually it remembers when it's met a germ. And what I'm trying to produce in this analogy here is when you see this germ for the first time, it's like memory, isn't it? If you were going somewhere to visit, you find it difficult to get there. But once you've gone there several times, you know the quicker route, you know the shortcut. And basically that's how the body works. The body remembers this. So the response that the body makes is quicker and greater. This is really fundamentally important. And it's one of the reasons why I got into immunology. The fact that your body remembers this immune response. But let's think about it in terms of this antibody, what people have been talking about. What this means by your body is that when you see this virus or this microbe or this germ on several occasions, you are actually making more glue. It's remarkable, isn't it? The body remembers this and it actually makes more glue, makes more antibodies. So when you actually see the germ again, your body's already prepared. Your body says, aha, I recognize you, and it will destroy you. Basically, what we refer to this as what we call protective immunity or lifelong protection. Now, the problem with making this glue is that for some people, making this antibody takes time. Making this antibody is such that the virus sometimes will go quicker than you make the glue. And so because of that, that's one of the reasons why we need vaccines. Think of vaccines as actually providing the knowledge for our immune system to make that glue, but it doesn't cause disease. As Dr. Donlisco pointed out. So that's why we need vaccines. Okay, so again, my analogy of a superhero. Vaccines are harmless forms of the disease, and what they do is it's used to practice your immune system. So now when you meet that microbe, your body's already prepared and it can destroy it. On this slide, I hope you can see, is the vast majority of diseases that have been conquered because of vaccination. If someone's technical, this is the slide where we talk about antibodies, and there's a reference. But before I go, I just want to remind folks of the power of vaccination, because many diseases have been eradicated. Let me remind you of measles. Prior to the vaccine of measles, and anyone who was around, particularly in the 50s and 60s, you know, like my parents, my mum in particular, has often reminded me about, you know, those diseases that occur in the 60s. Measles. Measles has now been more or less eradicated because of vaccination. Then there's diphtheria. And I put this slide here because this is a campaign going back in the 1950s and the 1960s, a campaign to encourage, and people were taking up the vaccine for diphtheria, because diphtheria is a terrible disease. But again, vaccination has proved it really important. And here's another one about whooping cough, a terrible disease in children. And this reminds us the importance of taking vaccine, because when there was a dip in taking up vaccine, outbreaks start occurring. So we know the importance of taking vaccine, and the majority of us do take these vaccines. And this is what the concept of what we mean by herd immunity. And what we primarily mean by herd immunity is that when there are very few people being vaccinated, the disease has the opportunity to spread, okay? Because there's a lot of people that have not been vaccinated, so the disease can spread. However, when more people are vaccinated, what happens, the disease can't spread, because vaccines do two things. One, they will provide protection. So they increase morbidity and mortality. They reduce morbidity and mortality. They boost your immune system, as I said, but they also do something else. They actually prevent the spread of the disease. And I've got a slide that looks at the current data with COVID. And in fact, this is something that John spoke about. And let me remind you before I go that how vaccination has been incredibly important. This is the global uptake of a large number of vaccines around the world. You know, billions of people have been taking these vaccines. And if we look at both in the world and in the UK, we see it's been incredibly remarkable. Do COVID-19 vaccines work? And we can take more questions. And I think John has really made a fantastic presentation by giving you, the whole idea of vaccines, its safety, it's been used in a diverse population. But here are some recent data to show that even the single jab can provide protection, and it does what it's supposed to do with vaccines. It reduces the hospitalization, which was spoken about earlier, but there's now evidence that it's actually also stopping the spread of disease. So let me summarize. Our immune system is incredibly important throughout life. What vaccines do is they provide a safe route for us to develop and boost our immune system. And importantly, herd immunity can only be achieved by vaccination. So when we talk about natural infection, the natural infection can't actually give you herd immunity, because in certain cases it can kill you. That's not the case with vaccine. And I want to make a really important point that we forget, and this is something that's been mentioned by the UN and also by the WHO. Next to clean water, and this is really important, vaccination is one of the most effective methods of public health. It's been shown to increase our lifespan and our livelihood for many people around the globe. So I'll stop there, and we'll take questions. So thank you.
Dr. Palmer, I've got a couple of questions for you. One of which is, are there some people who should not have the vaccine for medical reasons?
Yeah, there are some. So, and one of the reasons why there have been multiple development of vaccines. So there are a whole host of vaccines, and there are vaccines, for example, which what we call attenuated. And what we mean by that, it's a live virus, live microbe, but it doesn't cause disease. Now, we generally find for those vaccines, you wouldn't give those vaccines to individuals that are immunocompromised or individuals that are on immunosuppressive drugs, right? Because they may revert back. So there's always been a need to develop vaccines that are, if anything, a slight more of a mimic, but don't really have the ability to cause disease. And in fact, as John says, these are one of the safest vaccines because they actually are just a part of the virus. So they can't cause disease. So in essence, the current COVID-19 vaccines that are on emergency measures are safe to use for almost all individuals. And primarily, they don't cause disease. And that's really important. And partly the thing that John mentioned, you have to remember the side effects are the side effects of the body's response to something that's, to something that's that is foreign. So that's the body's response. So in essence, the side effects that one sees is actually the body's natural response to a germ. But in this case, it's just a small part of the COVID-19 vaccine.
Okay, thank you, Dr. Palmer. I could see the questions are now coming, but I'm going to introduce Dr. Joan St. John, who will do the final presentation, and her presentation will be about the challenges of local people taking the vaccine and the questions that they pose when they come to her or when she's contacted by them. So, Joan, I'm going to hand over to you.
Thank you very much. I hope you can all hear me. Thanks very much to my esteemed colleagues. It's fantastic in some ways to do webinars like this because I always learn something. So thank you very much, esteemed colleagues. Thank you very much to Willesden New Testament Church of God for inviting me. Thank you to Councillor Johnson and also Dawn Butler MP for the introduction. My name's Dr. Joan St. John. For those of you who don't know me, I've worked in Brent for many, many years and still work in Brent. I now specialise in diabetes as part of the North West London Diabetes Transformation Programme, so there's a bit of a mouthful. And I'm also doing a voluntary role for Diabetes UK as a clinical champion. So I thought we could look at this in terms of what people say to me when they meet me, and the choice that they are having to look at and the choice that each of us has to make. So the choice is really, is it safe for me to take this vaccine? And I'll look at that in a bit more context. Or is it safer for me to do something else? So are we talking about how you increase the risk of having an impact from the vaccine, or how you perhaps decrease the risk of having a severe impact from the vaccine? So there's a choice to be made. There's a question that goes on in our head. Before I acknowledge the concerns that people have, the legitimate concerns that people have, and that is sometimes causing some of the lack of confidence that people have about taking the vaccine, I want to give my condolences to everybody who has either lost somebody because of COVID and the widespread and knock-on effects of COVID, not just the infection, but also anybody who's been left disabled by COVID as well. So some of these legitimate concerns have been raised here this evening. So systemic medical racism is a truth, is a fact, does exist. Concerns about compatibility with religious practices, cultural beliefs, and how that impacts your decision making. Lack of trust in authority, because the vast majority of people on the meeting here who voted in the poll said it was a lack of trust about the information coming from government that made them not take the vaccine at the moment. Pastor Bell touched on disinformation spread through social media. Dr. John Licorice talked about the disproportionate impact of COVID-19 on people of colour. Of course, people have concerns about vaccine safety. Dr. Licorice also raised the socio-economic factors, and then we've got the historical facts. So I want to acknowledge those. Those exist, those are real. But how does that translate to what people say to me when they come to see me, whether that's in a vaccination clinic or somewhere else? The major concern is this vaccine safe? And that breaks down into mainly people being concerned about things like side effects and people's concerns about future effects. And I'll touch on both of those in the talk that I'm going to give. Another one that's just recently been raised in the chat also is, if I've got a medical condition, will taking the vaccine make it worse? Of course, I'm going to be focusing on diabetes because that's you know what I'm specializing in now. But people with heart disease, kidney disease, asthma, lupus, sickle cell, cancer, people are concerned whether or not this may taking the vaccine may make it worse. And then the third aspect of people's concerns is basically they don't feel ready. So they want to wait and see what happens with other people who've had it. And then there are the group who say, well, I'm only going to take it if I have to. So that may be for work, or the pull of travel may mean that people will take it. So those are the concerns that people have voiced, raised in one way or another with me, if they're talking about the vaccine. So let's look at them. I think first of all, we have to look at COVID-19, the infection, before we look at the vaccine. So COVID-19, the infection, again, there is a choice. Do you do things that might increase your risk of having a severe impact from this COVID-19 infection, or do you look at things that are going to decrease your risk? Because it's always about a choice. You've heard risk and benefit mentioned. So it's about what's good for me, what's not so good for me, what's going to be an advantage for me, what's going to be a disadvantage for me. That's the question that you are making constantly. So let's look at the infection. So the infection can cause a number of different symptoms. It can cause fever, it can cause cough, tiredness, chills, sometimes with shaking, body aches, headaches, sore throat, congestion, loss of taste, loss of smell, nausea, vomiting, diarrhea. So it can cause all of those symptoms. Well, you might say, okay, well, you know, that's fine, that's not serious. But as we've got more knowledge about this new infection, then we've discovered that there's this thing called long COVID. And long COVID, we're working on the definition, because remember, this is a new infection. It's just over a year old, really, in a way, our experience of it. So long COVID is when you've had symptoms for more than 12 weeks. So the Office for National Statistics estimates that about 10% of people who have a positive COVID test might have had or be having long COVID. And so what might you face if you had long COVID? Extreme tiredness or fatigue. I've heard people say that, you know, they used to run, they used to do marathons, and now they can barely get up the stairs. Shortness of breath, chest pains, tightness, heart palpitations, dizziness, joint pains, ringing in the ears, feeling sick, diarrhea, high temperature, rashes, hair loss. But then there are also these what we call neuropsychiatric symptoms. So brain fog. So you don't have the same concentration ability that you used to have. You can't think through things as you used to do. Difficulty sleeping. You might get things like pins and needles, depression and anxiety, and again, that extreme tiredness. So COVID infection is not something to be dismissed. And what about this severe or serious impact on health? If we cast our minds back, and we don't have to go back too far, let's go back to the beginning of this year, when that curve was just going upwards. Remember, with COVID infection, some people may require hospitalization. They might have to be admitted. They might require oxygen therapy. They might require ventilation, medications, and then a long course of rehabilitation. So let's not dismiss COVID-19 infection. The shortness of breath, respiratory effect, again, the fast heart rate, lack of oxygen. And we've seen those terrible pictures coming from India where people have been suffering like this. Liver problems, heart problems, kidney damage, and blood clots. So one of the members of my family had a stroke in her 50s because of COVID infection. And one of the reasons why I do this webinar or do webinars like this is because too many, as MP Dawn Butler said, too many people in my extended family, friends of mine, people I know, have suffered either ill effects from COVID-19 infection or have sadly died from COVID-19 infection. And what I don't want is that to happen to anybody when it doesn't need to happen. So what I do want is to hopefully provide information along with my colleagues that will help you make an informed decision, that you can feel confident about the decision that you make and protect yourself from these effects and your family as well. So why do we think it's so important? Because for us as Black people, certainly in the first wave, if you look here on the left-hand side, the rates of diagnosis by ethnicity were quite high, disproportionately high among Black people. But if you look at the proportion of cases admitted, again, in the first wave, we were overrepresented in these figures, along with people of Asian origin. We were overrepresented. And what did that translate to? Unfortunately, we lost lots of our family members. We lost lots of our friends. We lost lots of our work colleagues. We were overrepresented in these figures. And these are figures that we don't want to be overrepresented in. So this is from the first wave. If we look at the current information, there's about 127,000 people who have lost their lives in the UK to COVID-19 infection, but I think it's actually more than that. And I think when we look back, we will find that it is more than that, because it's not just the direct effect of the COVID-19 infection, it's also the knock-on effects of COVID-19 infection, that people haven't been able to go to hospital for other reasons, you know, for other illnesses, for other conditions, or go and see their GPs for those conditions as well. So I think we're going to find actually the deaths are going to be a lot more. And also the disability. So it's not just about death, as terrible as that can be, the loss can be, it's also about disability. So I want to pay tribute to somebody who looks like us, somebody who looks like me. She's a lot younger than me, Dr. Corbett, because Dr. Corbett has done some fantastic, she also, like Dr. Palmer, is an immunologist. And she's done some fantastic work, I think is mainly with the Moderna vaccine. So I just want to show that, you know, there have been experts who look like us working in this field to try and bring about some protection for us from this virus. So, you know, the priority groups that we had, we've actually smashed that in the UK. We've done really well in terms of the general population, but we're not talking about the general population here tonight. We're talking about the Black population primarily. This is a Black-led church, and also people of colour and people who have some lack of confidence about taking the vaccine. Dr. Licorice touched on this. I just wanted to show that there were diverse communities involved in the trials to look at the vaccines. So actually, quite unusually, there was about 10% of the trial participants who were from the Black population, because on the whole, we don't tend to volunteer to take part in trials, but there were 10% of Black people involved as trial participants. Okay, so I talked about the infection and what symptoms you can get. Let's talk about the vaccine. What symptoms and signs can you get from that? Now, the vast majority of people get pain in the arm. That, you know, I said the vast majority, and yet I put less than 40%. But most people will have some discomfort in their arm. And again, less than 1 in 100, but more than 1 in 10 will get mild symptoms, or can get mild symptoms of fever, muscle aches and chills. As Dr. Licorice said, these will last for less than 7 days. For most people, that's been a day or 2 at the most. but more people seem to get it after the second dose. So just to be aware of that. So chills, fatigue, muscle pain, joint pains, headaches, I'm going to say a bit more about that, and fever. So that's what your expectation would be, okay? So that it may last a day or two. It should not last for more than 7 days, and it should not be anything more than mild. And if you're finding that it's more than mild, if you're finding that it's lasting for longer than 7 days, then you should definitely make contact with your doctor. So the clots that everybody was worried about, suggesting this very rare form of problem in the blood system to the brain, what would you look out for if you were concerned that that was affecting you? So it's a headache, but it's a new type of headache. It's a severe headache, which is getting worse and doesn't respond to the normal painkillers. So if you saw me in the vaccine clinic and I said to you about the symptoms that you might expect after the vaccine, I would say you can take paracetamol for it if you want to. But if you had a headache that was so bad and you'd taken paracetamol and it wasn't getting better, definitely that is a red flag symptom. That is something you should be contacting your doctor about. Or it might be an unusual headache, which seems to be worse when you're lying down or bending over, or you've got blurred vision, vomiting, nausea, difficulty with speech, weakness, drowsiness, something like that. Those sorts of things are definitely going to alert you to contact your doctor. And if you had unexplained bruising or bleeding, shortness of breath, chest pain, leg swelling, or persistent abdominal pain. Just to put it into context a bit, the risk of blood clots, because people are very concerned about the risk with the AstraZeneca vaccine, we're talking about 4 cases in a million, so a 0.0004%. When you compare that to the pill, which is a 0.5% to 0.12%, you can see that you've got much more of a risk of blood clots from the pill, and smoking of 0.818% than you do from the AstraZeneca vaccine. And you can see here also the risk from the COVID infection, which is 16.5%. So you've got a much, much higher risk of having a blood clot from actually catching COVID infection than you do from the AstraZeneca vaccine. So I hope that puts that into some context for people who have concerns about that. But, you know, the risk and benefit, the advantage, the disadvantage, that choice that you have to make will vary depending on your individual circumstances. So it might vary depending on your age. And you can see that when you're weighing up what might be the benefit to you, what might be the risk to you, that as you get older, there is more benefit compared to the risk. And that's why the priority groups tend to focus on age as the main priority, but also focused on medical conditions. A lot of people ask me about pregnancy, breastfeeding, fertility, because there's been a lot of, I'm going to call it misinformation on social media about this. It gets to the heart of everybody because that's such a fundamental thing. So for those who are concerned about it and for those who want some more information, if you shine your phone camera at the QR codes, it will take you to a link for the Royal College of Obstetricians and Gynecologists. And there you'll see some videos and more information about the risk and the benefit to women for taking the vaccine or not taking the vaccine. I want to just give you a little bit more information about that. The current advice is that for women who are pregnant and or breastfeeding, that if you have one of these conditions, or if you fall into one of these categories, I should say, then it may be of more benefit for you to take the vaccine than not take the vaccine. But you will notice at the top here in the title, I've put a link to a PDF, which enables you as an individual, because we can give some general information, but you as an individual have to make this choice. So you as an individual can have a look through that PDF that I've given the link for there, and you can, on the basis of what the information that they've put there, you can make the decision about whether or not this is the right thing for you. If you are pregnant, thinking of becoming pregnant, if you're breastfeeding, or if you're wanting to become pregnant and not pregnant yet and want to make that decision. So current advice is that if you have what we call high-risk medical conditions, so any number of things, heart disease, kidney disease, liver disease, serious medical conditions, if you're at high exposure risk, so like myself, a medical worker or work in social or healthcare work, then you're at high exposure risk. Or maybe your personal factors put you at risk. So your age, ethnicity, BMI, your body mass index, I should say, or you've got other underlying health conditions, or you've got gestational diabetes, which means you have diabetes during pregnancy, or you're pregnant and you've got a body mass index above 40, or you're aged above 45, then you may think that it's actually better for you to have the vaccine than not have the vaccine.
Dr. John, we've only got 1 minute left.
Yep, I'm summing up. So health is about so many different things. It's about your faith, it's about your family, it's about your economics, it's about so many different things. And it's all this information together that you are going to put together when you are making your decision. So COVID-19 vaccine, the choice, you can either increase the risk of having a severe impact from COVID-19 infection by increasing your exposure to that infection, or not looking after yourself in terms of your medical conditions, or not having the vaccination. Or you might decide that you want to decrease the risk of having severe impact from COVID-19 infection by decreasing your exposure, so hands, face, space, lifestyle factors, so looking after your medical conditions, be that diabetes or another condition, and taking the vaccine. Now, some of us have done work to try and give information to people so they can make informed decisions. The local hospitals, we've done some work there. Professor Fenton has given some great advice, and I think as a church, maybe this is something that you would like to consider about how we build back better as communities. I've here listed some trusted sites for information. If you think that you know, everybody in hot climates is safe from COVID, have a look on this site and get an answer to your question. But there's lots, you know, there's about 5G and lots of different things and some resources there. So thanks very much for your kind attention, and I'll leave it there.
Thank you, Dr. Joan. An excellent presentation again. We've now come to the place where we're going to be putting questions to the panel, and we've got at least half a dozen questions. I'm not sure if Pastor Bell is in the room. No? Okay, well, I'm going to raise the first question, which was asked: what comfort can the panel provide to those who are concerned about previous experiments on Black people, particularly if they view COVID vaccines in the same light? Dr. John Licorice, Dr. Donald Palmer, if you have can address that question.
Well, I think, as I said earlier, we know the legacy of medical racism or the experiments that have been done. But I think, as Dr. St. John has just mentioned, I think we can be sure that in this time we've got esteemed colleagues, people looking like ourselves who've been involved in the research, have been in the forefront. Many, again, people like Dr. Palmer, we've all looked at the science, we've all looked at the evidence. So I think we can be clear in saying that in this time that there's been a lot of scrutiny, and many of our colleagues, have, not just colleagues here, but other colleagues have been looking at it, have been involved in the research in this time.
Yeah.
Dr. Palmer?
Yeah, I agree very much with what Dr. Licorice commented on. I think the key thing, and I'm really grateful for all our speakers who initially mentioned the idea of recognizing that the concerns in the community is legitimate and it is real. And it's important that we respect and we address that. But it seems that the vaccine, if anything, or particularly this COVID-19 vaccine, it might be a proxy, but more importantly, to speak to our community so that we can address their concerns. Because what the key thing about it is what's going to happen post-COVID. For example, Black women and pregnancy. So it seems to me the enthusiasm we have about COVID-19 vaccine, I hope doesn't go away, but it's used to address some other and more important inequalities. And I think what Dr. St. John said was really key. It's about our community having the correct and the right information so they can make an informed choice.
Okay, thank you.
I think Joan wants to say something.
Yeah, go on, Joan.
I was just going to say very briefly, yeah, I absolutely, I acknowledge medical systemic racism. I think you've got to. Very briefly, the vaccine is offered to everybody. So there's no special vaccine that they're offering to Black people. The vaccine is offered to everybody. When you come to the vaccine clinic, everybody gets the same vaccine. So I'll just leave it at that.
Yeah.
Okay. Thank you. Another question came up. If you have a top-up corona jab in the autumn and you still have to have the flu jab, are these possibly going to happen at around the same time? Dr. Joan.
Okay, I haven't received the information about the top-ups in the autumn yet, but my understanding would be that they wouldn't happen at the same time. I may be wrong there, but currently we normally say leave at least 7 days between vaccinations. So I would assume we'd probably be following a similar pattern with the top-up.
Okay. Right. How do we feel about aborted fetus being involved in vaccination? Is the aborted fetus still being used, or is this research in vaccine was used in the past? Dr. Palmer.
Yeah, that stuff was very much used in the past, and what's really important is to recognize that how vaccines or viruses are made using cell lines, but these cell lines have been developed many years. Now, don't get me wrong. I think the ethics, and I know both, Dr. Licorice and Dr. St. John will know this. The ethics now of using cells, etc., is very different than it was, say, in the 50s, 60s, and 70s. And I think scientists have put their hand up in that regards. But this is what I said earlier on, because of the concerns about using cell lines, etc. This is why there've been the development of what now people are referred to as synthetic vaccines, where they've been completely removed from the cell, and you can develop them in a different way to avoid such issues. For example, they don't contain any animal products, don't contain any pork or gelatin or whatever. So in that way, to address, and that's why vaccine development has been going on for many years. And as pointed out, the current products don't have any animal products, etc.
Okay, Dr. Licorice, do you want to come back on that one?
No, I said to you the issue about the formation of cell lines. It dates back to the 1960s. At the time, it was something that was done with the ethics at the time. Those cell lines were used, and a lot of the early research were used because people understood them. But as Dr. Palmer said, science has moved on. As I said in my presentation, we develop vaccines in totally different ways, in totally different formats with regard to them. So.
Okay, there's a question in the chat saying, what are your views about the 23 people who died after having the vaccine in Norway? Are you aware of this?
I can speak to that. Yeah, I can speak to that. That's something, yes. When Norway first started vaccinating to use Pfizer, again, if you look at what happened in the UK, it was often, as Dr. St. John had mentioned, it was very elderly people who were most at risk. So what Norway did, I guess, looking at something what happened in, I guess it was looking at our experience actually, was they used the vaccines in very frail, very elderly people. And many of these people had multiple underlying conditions. And as a result, some of these people died. But a lot of work was done to look to see what was the cause of death. And it was not actually related to vaccines. It was just the fact that these were very extremely, very frail, very elderly people.
Okay. We've got about 3 questions left and we're running out of time. So I'm going to quickly put the 3. What is the benefit of the potential to possibly mix the booster vaccine if you are given the first or second dose as AstraZeneca and then given Moderna or Pfizer as a third? Does that make sense to you?
Yeah. So at the moment, there are just some studies that are going into clinical trials. So various countries are looking to see if you can say, if you use the Pfizer, can you then use the AstraZeneca for the second? At the moment, the advice is whichever vaccine you has as your first dose, you should use the same vaccine for your second dose.
And the third dose?
The third dose, as John mentioned, that's basically going to be something which we'll have to wait until we see what happens.
Okay, okay. All right, you've mentioned the issues about blood clots. Which vaccine would you suggest if you've had blood clots in the past?
Okay, I'm going to try and be brief. I'd want to know the reason why the person had blood clots. Remember, I'm always saying it's about the individual and their risk and benefit. For a general answer, what I would say is to have either the Pfizer or the Moderna vaccine if blood clots is a concern for you as an individual.
Okay, and the final question, and I think Dr. Joan and Dr. Licorice may take this. If you're under 40 and you're given the first dose of the AstraZeneca vaccination, when should you be given the second dose?
Currently, it's about 12 weeks, up to 12 weeks, let's put it that way, because some areas have been able to do it at a shorter time interval, but it's roughly about 12 weeks. And one of the questions that comes up sometimes is if you've had first dose AstraZeneca and you're below 40, should you go for the second dose? Well, the advice is that if you were fine after the first dose of AstraZeneca, it's fine to take the second dose AstraZeneca vaccine as well. And can I just make one more point to say that if you've got medical conditions, you're actually better off to have the vaccine than take the chance of getting the infection, because people with those medical conditions like diabetes, heart disease, liver disease, kidney disease, if they get the infection, have not unfortunately done very well having had the infection. And so it's safer for you to take the vaccine. So just wanted to make that point very clearly.
Okay, I think I've come to the end because we're running out of time. I just need you as presenters to put your learning points across a given 30 seconds. So I'm going to start off with Dr. John Licorice. 30 seconds of what were your learning points in this presentation?
First of all, thank everyone for inviting me. I think my learning points were, I guess, it just giving an opportunity to understand the concerns of the community, as always, to learn from my colleagues. And I guess as well, just to encourage everyone to look for evidence, look for the facts that they're listening to people like my esteemed colleagues when you make the decisions for whatever is necessary. Please consider that and take the vaccine when the opportunity comes.
Dr. Palmer.
Yeah, very much echo that. Our community, we recognize these are legitimate concerns, but yeah, I agree with my fellow panelists. The key thing is about making an informed decision. So more importantly, make sure you get the fact from trusted sources. And that's really key. And what's really key is the fact that I've shared platform with many of my colleagues here, and it's really good that we get robust and challenging questions, but the same must also apply by the information you receive as well. So yeah, make sure you get, you got the correct information so you can make an informed choice. And again,
Okay.
thank you for everyone for being here.
Dr. Joan, 30 seconds, please.
30 seconds, okay. The word I always use is Ubuntu. I am because you are. So I want us all to be healthy as a community. Each one teach one is the other thing. So if you've learned something from today and it's been valuable to you, then please go and share that with someone. As both of my colleagues and Pastor Bell had said previously, trusted sources. Go to resources that you can rely on, that you can question, and they can legitimately answer those questions for you. Thank you very much for inviting me, and I wish you all good health. And the other thing is build back better. I think as a community, we need to look to make our health better going forward. So I'll leave it there.
Yeah.
Thank you. We do have one final question, and it says, how can you get a vaccine that you would prefer if you had blood clots in the past, or if you have a blood condition?
I answered that in the chat to say that speak to your GP
Okay.
and they can try and get you booked into one of the vaccination centres where you would be able to access that particular vaccine that you want or is right for you as an individual.
Thank you to all our panelists who've done excellent presentations. I'm going to ask for the closing poll now to be put up. Could everyone make sure that they answer the questions?
Yeah.
Has anyone started? Give you one more minute. Twenty seconds. Okay, 5, 4, 3, 2, 1. Ended the polling. I'm now going to share the results. Right, this webinar has helped me gain, and 88% has actually said greater trust in information about the vaccine. 6% greater trust in the vaccine specifically. 6% in greater trust in vaccines generally. The second one is saying, I'm still hesitant because 12% says medical concern and 88% has none of the above. And given what I've heard, I now intend to take the vaccine. 82% says yes, and 18% says maybe. So we can see that there has been a shift from the start of the webinar to the closing of the webinar, and really thank the presenters for doing such an excellent job in getting people to rethink about the vaccine. So thank you all again for turning up. Really hope that you found it really informative, and I'd like to say that maybe we could do this sometime again, but dealing with another subject matter. Okay, thank you and have a good evening.
Yes, thank you, everybody.
Okay, thank you. Thanks, everyone.
Yeah.
Thank you.